Neurology video series. What is a TIA? TIA stands for transient ischemic attack. Transient ischemic attack, or TIA, I believe is the most overdiagnosed condition in neurology. A TIA is a transient stroke where the blood clot breaks up basically before it can cause a stroke, and it usually lasts less than 24 hours. There's no residual deficits from a TIA. You do not see a TIA on a scan. It does not leave a trace. It does not cause disability. What a TIA is it's a warning that if you do not treat the patient with adequate change in their risk factors or the blood thinners, that you can get a stroke in future. I would compare TIA to angina and a heart attack, but there's no residual damage from a TIA, and you do not see a TIA on a scan. Often, as I said, it's the most overdiagnosed condition. If you get recurrent stroke-like symptoms constantly, like on a daily basis, or even 3 or 4 times, it's almost never going to be a TIA. A TIA does not cause recurrent stereotypic symptoms, because that would mean that the blood is getting clotted in the same blood vessel each time, causing exactly the same symptom. If you're going to get recurrent symptoms which are very similar, then you're either dealing with a migraine aura, even in older people, or you're dealing with partial seizures. You're not dealing with a TIA. The one thing you have to be careful though is to make sure there's no significant vascular stenosis, meaning there's no really tight blood vessels in the brain causing these recurrent stroke-like symptoms. So especially in older people, I do want to rule that out before telling them these are not TIAs. But again, a TIA is often misunderstood, overdiagnosed in the field of neurology.